to the extent going forward that we can be cognizant, you at the agency and us legislatively, cognizant of things we can do to reduce the burden on physicians and people who actually provide the care. Insurance, yeah, that's one thing, but if you haven't got someone there to provide the care, the darn insurance card doesn't do you a bit of good. And I do worry that we have put a lot of burdens on our men and women who practice medicine in this country. The electronic health records have been a significant burden. I know there's some concern as we go through some of the Medicare structural reforms. Just for the record, it was important to get rid of the sustainable growth rate formula. We did that. I did think it was going to take longer than 5 years for whatever came next. I lost that argument, and it is to be done under a 5-year time interval. However, I think you can see from last Friday's vote that the Congress, the legislature, is willing to provide, if there is legislative relief that is needed as far as the timeline or as far as the flexibility, we are prepared to provide that for you. Remember that this bill, the Medicare Access and CHIP Reauthorization Act, passed with 393 House votes, 93 Senate votes, big bipartisan majority. A lot of us have a lot of equity and ownership of this, and we want it to be done correctly. That's probably the most important thing. We've had a number of hearings already. We're going to have another one as macro affects small practices, and certainly work closely with Secretary or Administrator Seema Verma over at CMS. And again, I just commit to you that we want to do what we can to alleviate that burden. You had mentioned the interplay between prescription drug monitoring programs and electronic health records. That, I guess, would be one of those opportunities to reduce the burden on practicing physicians if there's a way to seamlessly integrate that. I don't know if you can do it as far as the privacy concerns, but that is, I think it's something worthwhile to look at. But I would also say, and I think you touched on this, there's a lot of data that the Center for Medicare and Medicaid Services has. And to the extent that you can identify a practitioner who is writing an inordinate number of prescriptions, a pharmacy that's filling an inordinate number of prescriptions, a pharmacy that's taking delivery of an inordinate amount of product, these are things that are actually knowable within the data that's locked up in the Center for Medicare and Medicaid Services. So again, I hope we will work with us as far as trying to, I think too often we'll point to our physician community and say, you guys got to tighten this up because we got an opiate crisis in this country. And yet there are places where from the agency perspective, we could tighten things up and perhaps drill down on where some of those problems actually occur. You've been very generous with us today. There are going to be questions coming to you in writing. I have several that I will send you. With that, the subcommittee stands adjourned. And again, thank you, Mr. Secretary.